What questions so far? Let me go back up and ask some of these or answer some of these if I can get up here and see them. You guys enjoying this? Good. That makes me happy. How do I find this? If I didn't answer your questions, go back and do it. What about diverticulitis? Yes, it's inflammation of the intestines. What's that come from? It comes from leaky gut. Diverticulitis, diverticulosis, Crohn's, colitis, irritable bowel disease. I put my cancer patients that have especially bowel cancers on this, all that kind of stuff. What about issues of arthritis? Arthritis is here. If you have inflammation because the gut's not working, that's going to come there. If your gallbladder has been removed, is it safe to take these? Absolutely. You need to be on these if your gallbladder is removed, and you should also take a little bit of bile salt as well. What about MS? MS is an autoimmune disease. It's an inflammatory disease that lives inside the nervous system. So you need to make sure, Donna, two things are working right with you. Number one, that your nervous system's good. Number two, your gut's good. You got to make sure you do that. What about prostatitis of the prostate? Any type of that's inflammation. So listen, I love it. I love you guys asking these questions, but the answer is going to be the same. It don't matter what the symptom is if the cause is the problem. What about if you had a melanoma? If you should take it, yeah, for sure. Can someone who has blood thinners? Yes, there's no blood thinner contraindication to this right now at all. I have an MS customer who's gotten amazing results. Awesome. I'm not surprised about that at all. Fatty liver issues. You'll never, okay, let me talk about this for a minute. This is important. Fatty liver is more common than you think. Most of y'all probably haven't even been checked for it. If you go do a blood test, you look at your ALT and AST levels. Those are the liver enzymes. And if those are elevated, that means that you probably have a good chance of some fatty liver going on or some non-alcoholic cirrhosis starting. All caused by the standard American diet, which is SAD, the SAD diet. Too much sugar, too much carbs, too much juice, too much junk food, sometimes alcohol, but usually that's it. If we get the bowel shored up, if the bowels work, if the large intestine, small intestine are working better, that's going to take pressure off the liver gallbladder. That's going to allow the liver to take fat and burn it as fuel. If you have a fatty liver, that means your body's burning sugar as fuel. You're more prone for diabetes, more prone for neuropathy, more prone for inflammation, all because your problem is here. You got to fix this before you can fix that. So pancreas, blood sugar problems, type 1 diabetes, liver, high blood pressure, fatigue, anxiety, people that get hangry, gallbladder, digestive issues, all that, because that's off. Adrenal glands, hormones go bad, sugars go bad, can't absorb minerals. Can mental health disparities such as bipolar? Okay, let me tell you something about this. This is a great question. So here's what we know about mental disorders, all mental disorders. I'm talking about schizophrenia. I'm talking about bipolar, manic depressive. And I know because I see these in my offices. There was a study that was done, gosh, I think it was 2018. You could look it up. It was 2018, 2019. It was recent. And it showed that some 80 to 86% of mental disorders are caused by nutritional dietary imbalances. The standard American diet, which does what? Screws up the what? The gut, which then screws up the body's ability to make the neurotransmitters. Now the neurotransmitters don't go to the brain like they're supposed to. Now we get all these problems with the brain not firing proper that leads to those symptoms. They're all the similar causes. The symptoms are different, and the symptoms get named differently based off of the group of the symptoms they've got. Does that make sense? Heart issues, is it safe? Yes, for sure. Absolutely it is. Cataracts, pressures in the eyes. So here's what I'll tell you about cataracts. That's an inflammatory issue, no question about that. So we get the GI right, that's going to help. You also need to look at some beta carotene, some vitamin A for cataracts as well. What about someone who has Hep C? Absolutely, heck yeah, because now that's an autoimmune type stuff. You're probably taking some type of interferon. That'll help you with this. Because all those, listen to this. If you're taking medications, that's going to stress out your liver. I'm not telling you to throw your medications out. That's between you and your doctor. I'm not saying that at all, because some of you need to be on these medications the rest of your life. Some of you can get off some of you can get off a lot of them. But if we can clear up the clutter, we can give the body the ability to repair itself. And then your symptoms go away. That goes from that disease to disease back to ease. Does this help with PTSD? I cannot tell you how many people that we see with PTSD. Cochrane Hospital here in St. Louis is a VA hospital. And we do a lot of work with them. I'm just telling you, the brain and the gut are related. It's called the brain-gut connection. Let me just try to show you this a little bit differently. So you got your brain up here. You got your gut down here. I know I'm a horrible artist, but whatever. So all of the chemicals, they're called neurotransmitters. Neurotransmitters. Serotonin, noradrenaline. By the way, what happens is when people get these symptoms, all the symptoms of emotional stress that you talked about, they start taking serotonin inhibiting medications. They stop serotonin from getting absorbed into the cells, because when a lot of it gets built up, we feel better. Well, if you're not making it here, you can't get it up to here. So instead of taking a serotonin inhibitor, why don't you just make more serotonin? I mean, common sense ain't that common, right? Do you understand what I'm saying? So absolutely do that. Can you take them if you're breastfeeding? Absolutely you can. And you should, because the healthier you are, the healthier your milk is, the healthier your baby is. Let's see. Kim, I'm glad you're appreciating this. Is it safe for someone with AFib? Abso-freaking-lutely. Look, inflammatory stuff and cardiovascular stuff is all right here. Got to fix the GI tract first. Hypothyroid, absolutely. There's your endocrine system, thyroid right there. The gut, listen, step 1. You can't go to step 2 without step 1, okay? You can't go to step 3 without step 2, right? The gut is the problem, and no one is going after this. No one is. We are. You are. So here's the deal. Once you understand the benefits and the power of this, like, we could have easily taken this and put it out to the pharmaceutical world, out to the doctors out there, but said, here, doctors, you run with it. But we want to give it to you. We want you to be the doctor. We want you to understand the power that you hold to heal yourself. So once you see this happening, like all you are commenting right now about how it's personally helping with PTSD, how it's personally helping you with your autoimmune stuff, how it helped you with your lupus, all this kind of stuff. Once you see it happen, now you have to share with somebody, because here's the deal. If you have the ability to do something, you have the responsibility to do it. That's why I'm here with you tonight. That's why I'm sharing with you tonight. So I hope this makes sense. Lyme disease, abso-freaking-lutely. I see that all the time. Just a reminder, allergic reaction to the cold. It's not an allergic reaction. Thanks for reminding me, though, Kathleen. I appreciate that. That's an adrenal and a thyroid problem. So the adrenal and thyroids help circulate and push blood through the body. When you get cold sensitivities, that is an adrenal and or a thyroid problem. That's an endocrine system problem. Don't think about just the individual organs. Think about the system. Don't think about the GI tract by itself. Think about the whole system. Don't think about the nervous system by itself as a nerve. Think about the whole system. When the GI tract ain't right and your gut's leaky, then your endocrine system isn't going to work. And do you remember? Yes, for seizures, that's brain inflammation. Parkinson's, yes, that's cerebellar inflammation. Okay, listen to me. Do you remember the spit test? There's a test that I taught everybody, I think it was a week or two ago, on how to give yourself an assessment to see if you have leaky gut. I mean, to see is to know, right? To see is to know. So here's a real simple test you can do. You must do this. It's called the spit test. Everybody write this down or just remember it, or record this again and read it, watch it, whatever. So here's what you're going to do. First thing in the morning, before you brush your teeth, before you drink anything, before you eat anything, before you do anything at all, you're going to get a glass of water, a clear glass of water. This is a glass. Fill it up to the top with water. You're going to spit in it. Just regular spit, not a goober, not a loogie, not a any of that stuff. Just regular spit, just saliva, just spit in the booger. And then let it sit for 15 minutes. You got to give it at least 15 minutes, at least. Now, some of you are saying yours already sunk to the bottom. You need to get on this stuff and stay on it until it don't sink anymore, and then stay on it the rest of your life, because that's how you want to feel better. That's your decision. I'm never going to stop taking this stuff. Normal spit should sit on the top, should float. If you have leaky gut, you're going to have candida overgrowth in your system, which, by the way, if you have nail fungus, toe fungus, if your tongue gets white, if you get fungus in your hair, psoriasis, skin issues, bad outbreaks on the back of your arms or in your thighs, you got leaky gut. That's just all there is to it. The bad stuff's leaking out. It's just that simple. It's just that simple. So normal saliva sits at the top. If it's leaky gut, it's going to streak, move to the middle, or sink all the way to the bottom. And people always say, well, is it sinking to the bottom worse than floating, or sinking to the bottom worse than staying in the middle or streaking? It's kind of like being pregnant. You either are or you are not. It's just that simple. Okay. So if it does anything other than stay at the top, that's positive. for leaky gut. You need to get on the Happy Triad. Remember the Happy Caps are an adrenal stimulant, because when the gut goes bad, the adrenal glands first get hammered, and you need that Happy Caps to keep you going. Okay, that stimulates the adrenals, helps with all that stuff while you're repairing your gut. While you're repairing, good. Is it safe to do post chemo? Yes, you can do it while you're on chemo. I have patients that are doing it on chemo right now. For people who are 100 pounds or more overweight, would this still? Yes, still take the regular dose for right now. Okay, absolutely. Start with the dose that it says on there. I have a team member asking, can it help with fertility? Well, here's the deal with fertility. If your body's so out of balance, if it's so stressed out, I just showed you, if the nervous system's bad, the GI system's bad, the endocrine system's bad. Involved in the endocrine system is the hormonal system. Well, that's how you drop an egg, fertilize an egg, and all that. But here's what I'm going to tell you about infertility. It takes two to tango. So you better get both these people on the products, on the formulas, on the protocols, whatnot. When the body gets healthier, it will allow you to have a baby and conceive. That's just the way it works. I cannot tell you how many times I've come home from work and said, hey, babe, guess what? I got another lady pregnant today. I don't know too many men that can say that to their wives. It's an inside joke because we help them get pregnant. Not me personally, but the work that I do. So anyway, let's see. What about the caffeine and the Happy Caps, caffeine sensitive? So here's what I'll tell you. Some people have more sensitivities to caffeine. So I would suggest, if that's the case, take a half a cap a day or a third of one. Try to find your dose, okay? Some of you may need to work on your gut a couple days, a couple weeks before you're able to take the Happy Caps. Everybody's body's different. Let's see, what else do we got? What about gastric bypass folks like me? How do you? Oh, this will absorb through the stomach. I have people that are on bypass or have the sleeve or whatnot. Kathleen, and there's no issue whatsoever, especially with the BioMyX, the 80K, the fat soluble absorbable. You need to be doing that because anyone who's had a bypass must be taking B12 every day, must have some form of good nutritional stuff for the gut, which the Happy Tides are awesome for that. And you've got to have A, D, and K, especially D and K. You have to supplement it. Safe during pregnancy? Absolutely, Barbara. Steve says low back, right side, persistent pain. Well, low back, right side, it could be a kidney. It could be a muscle pull. It could be a disc. Let me tell you something about disc issues. This is important. Let me draw this. This is a big deal. This is a big, big deal. So here's what I'll tell you. Those of you guys that have anybody that has spinal pain, disc herniations, disc bulges, degenerative disc disease, that kind of stuff. So this is your spine. There's a bone. There's a bone. There's a bone. Now, between the bones of your spine are these cushions called disc spaces. They're filled up with protein, vitamin D, collagen, and water. And out of these little spaces are where the nerves come out of. Now, if those disc spaces stay big and thick and happy and good, no worries, okay? If it gets small, it's going to pinch that nerve, cause back pain, etc. These disc spaces do not have direct blood supply to them. The only way that they get their nutrients to them is whenever you move the spine. Exercise, movement, getting adjusted, physical therapy, that kind of stuff. Guess what these guys suck up? They suck up the fluid that comes out of the intestines. So if you have a toxic, Toxick, toxic, that's how I say it, toxic bowel, you're going to have a toxic disc. Guess what that's going to cause? Back pain, disc herniations, ruptured disc, back pain that won't go away. That you got to get the gut right to get the inflammation to go away. I beat that to the pulp already. What about impact on stage 3 kidney failure? Again, it's all about getting your body healthier. Can I tell you that it's going to reverse your stage 3? Not at all. Can it make you healthier? Absolutely. Is that what you need to focus on? Absolutely. Permanent inner ear damage causing terrible vertigo due to overprescribed. Yeah. Here's what I'll tell you with that. there's two things that could, well, really three things. You get your inflammation down, that could help. Number two, if you got permanent scarring on the drum of your eardrum that's causing that vertigo, that might be an issue, because that thing about that eardrum is like a snare drum. If it's too tight or too loose, we got problems. You ought to go see a chiropractor as well that knows what they're doing. That would be good for you. Kathleen said, send a question above about not being able to absorb iron. I get infusions a couple times a year, B12 folic acid. I think you also have a bypass. Is that right? Don't you have a, didn't you do the GI bypass or sleeve? So you need to be on these products for the rest of your life. Lindsay says, from a customer, when I take the Happy Caps, it makes me super tired. Oh, she's toxic. She's super toxic then. No, don't stop taking it. Take it. Lindsay, tell her that, first of all, have her make sure that she's solid on the program and foods. Well, not foods, but on the Happy Tides, the BioMyX, and the nucleotides. Sorry. Have her do that solid. I would have her be on it for at least 90 days before she's probably going to see any difference. And that girl needs to push about a gallon of water every day. Just do that. About a gallon of water every day. And she needs to put 2 or 3 big pinches of pink Himalayan sea salt in that water to help her body get more alkaline. That'll help her a ton. Yes, this will help you with high blood pressure. Getting healthy helps with that. Got to get the aches and pains to go away. Here's the deal. Sex drive comes from low hormones. I just told you that if the GI system's bad, the hormones aren't good. By the way, guys as well, I see a lot of guys and gals that have poor circulation to their genital areas, which leads to women, you can't feel it when it's going on, and guys, you can't keep it going on, right? It won't get up to hang out and it won't stay around. Well, if you get your GI system right, it reduces inflammation, lowers your cortisol level. If your cortisol level goes up, circulation goes up, testosterone goes up, sex drive goes up. You guys, this is all related. It's like dominoes, man. When one thing's off, everything else falls. So that's just where there is to it. Let's see. What with the BioMyX makes you feel hot? So Roxanne, if you feel hot with the BioMyX, it's probably detox. You're probably trying to detox. Pernicious anemia, Carla, that's well, that's it. Yes, that would be so good for you. Great freaking call. Leaky gut totally leads to pernicious anemia because it backs up when the gut's stressed out. Now the stomach doesn't produce hydrochloric acid like it's supposed to. That's what causes the reflex. Fixing the gut fixes that, which fixes the anemia. You're totally right. You should totally be on that. Stay on this product nonstop. All right, a couple more questions, then I got to go hang out with my wife. It's our wedding anniversary. Suggested diet. I like anti-inflammatory diets. I'm a big fan of intermittent fasting. I like no breakfast. I like lunch and dinner in a small window. I like your diet to be, 80% dark green vegetables and lean meats, just a little bit of fruit, maybe some berries. I'm a big fan of drinking a lot of water. I try to push a gallon a day. I'm a big fan of herbal teas. Stay away from the standard American diet, processed foods, junk foods, all that kind of stuff. That's what you should do. Ken wants to know if he wants to start the triad a month before surgery. Yes, you should, because the healthier you are, like I have a lot of patients, unfortunately, that need to get surgeries. So they'll come to me so that I can put the healthiest specimen on the table, because the lower your inflammation is, the faster you heal. The lower your inflammation is, the less complications you have. You need to be the healthiest you can be, period. This is about health. It ain't about your symptoms. Remember, I tell people you got to think and link. Think about the symptoms, but link it to the cause. I just showed you the cause of some 80-90% of your problems. It's the GI tract and leaky gut. All right, let's see. Since I have been on gut health for 2 months, I'm finding, you're craving less sugars. Isn't that amazing? When your body gets right, it starts craving foods that you need. Starts craving foods you need. I feel like you owe me a copay. I appreciate that. I'm good. Terrell says, this is so good. Thanks for all the information. Everyone needs this product. Yeah, that's exactly right. I mean, I don't know what to say other than, in an ideal world, every man, woman, and child would be taking this in an ideal world. Because why wouldn't you want to raise healthy children? It's easier to raise a healthy kid than to fix a broken adult, but all of us broken adults need to do this. So I hope you guys appreciated this. I love and appreciate you guys so much. Please, please, please go back and watch these videos. I know we record them and save them. I know they live somewhere. You guys need this stuff. Share this with your friends and family, your doctors, your customers, potential customers. This is the truth, and the truth will set you free if you let it. But let me just finalize with this. Life is all about opportunities, right? We get all these opportunities all the time. all the time. The question is, will you take advantage of this opportunity within the lifetime of the opportunity? We are literally changing the way that healthcare is delivered. We're putting you in the driver's seat when it comes to health and wellness. And I'm going to tell you, once you have your health, you can have your wealth and everything else that goes with it. But I'm telling you, if you don't, regret is the worst thing that you could have. So get on the products, do the stuff, give it enough time to see what changes. And listen, I'm in Missouri. It's the show me state. Show me how much better you are. I want to hear every Wednesday or whenever I'm on with you guys, hey, Dr. E, this is what I'm feeling. Hey, Doc, this is what's going on. Look at all the great stuff that's happening. That's what I want to hear from you guys. So I love and appreciate you guys. Thank you so much for spending time with me this evening. I'm going to go hang out with my wife because it's our wedding anniversary. So until we meet again, I'm Dr. Eric Nepute. God bless you. God bless America. And God bless the world. See y'all soon. Bye, everybody. Good night.
Please get back to the person that shared this video with you. And while you're at it, subscribe and like this video.